Okay, I wanted to make a video in response to a commenter, and I actually like this commenter despite the fact that she disagrees with me. I actually don't mind people that disagree with me because they help me think more clearly. By disagreeing, it makes me think more. But what's interesting is this. Psychiatric medicine, the practice of psychiatry, as it is practiced today, not as it was practiced many years ago, is becoming further and further and further and further away from medicine and closer and closer and closer to voodoo. What many people refuse to understand is that psychiatric disorders are voted on by psychologists and psychiatrists at the Psychiatric Association. Okay? What else is very interesting is if you follow the history of psychiatry, psychiatry is not really legitimate biologically based medicine like other forms of medicine. The biggest problem, I think, with psychiatry is its inability to effectively treat the symptoms which are manifest as behavioral anomalies, which are causing people to behave in odd manners. Very rarely will you see anybody ever get any better. And I'm going to share a personal story. This same person humorously stated that I had been on that I was on psychiatric medicines. I have not been on psychiatric medicines in over 9 years, and the reason why is, and I'm going to share this, and I'll be quite frank, and this is completely true. As I stated, I was homeless for almost 4 years, and I will do whatever I need to survive. Okay, Darwinism states that survival is the first law. Okay, I had been hospitalized with hypothermia one time, okay? So after being hospitalized with hypothermia, I got a little rambunctious in the emergency room, in which case I was put into the behavioral health ward of that hospital for acting in an aggressive manner towards the nurses, probably due to the hypothermia. I was probably, from malnutrition, dehydration, and hypothermia, I was probably a little bit whacked out, not to mention not sleeping for God knows how long. Now, when I got to the behavioral health ward, I was put on a drug called Seroquel. Now, Seroquel is a very powerful drug, and I'm going to get to when I worked in mental health with a heroin addict and what her reaction was to it. Okay, so I was put on the behavioral health floor, basically. And while there, I was put on Seroquel. I had never had a panic attack in my life prior to being put on Seroquel. After spending, I would say, about 4 weeks on Seroquel, 2 weeks in the hospital and 2 weeks outside the hospital, because at the time I was in a weakened mental state, and I believed that, psychiatry might work this time. So I took the Seroquel for an extra 2 weeks. And this is verified by the police, it's verified by people that saw how I was reacting to it, and it's verified by many, many, many people that objectively can corroborate what I'm saying. I became very delusional on Seroquel. I suffered hallucinations on Seroquel that I did not suffer after stopping it or prior to taking it. I also had panic attacks that were very persistent and would last hours, okay? And again, never had a panic attack prior to Seroquel. After stopping Seroquel on my own, and after seeing a psychiatrist, an outpatient psychiatrist, that was very disturbed by the fact that I was put on Seroquel, because in his view, this outpatient psychiatrist, it was unethical to prescribe a drug that he felt was proven to be such a detriment to people's mental and physical health. So, okay, let me get done here. So, I was on Seroquel, and then for, I'd say about I continue to have panic attacks to this day, probably related to residual effects from the Seroquel, which is not very provable, and that's the problem with these psychiatric medications. However, I did get a lot better. My symptoms went from every day to, or I should say every hour at least, to, a couple times a week finally. When I started working in mental health, the panic attacks were much lowered. And how did I get them down? Well, I got the frequency of the panic attacks down, not with therapy, not with psychiatry, not with some magic pill, but by practicing two things. One, and I'm not promoting these things to people as an alternative to psychiatry. You need to talk to a medical doctor. I'm not a medical doctor. The first one was following the recommendations in the book Clear Body, Clear Mind by L. Ron Hubbard, okay? Because I was desperate to stop these symptoms. The second was the use of the Seventh-day Adventist Principles of Health. Again, I am not promoting, well, I will promote the 8 Seventh-day Adventist Principles of Health to everybody because they're proven to make you healthier. But I'm not promoting Scientology at all. I've never been to a Scientology meeting. I don't plan on being to a Scientology meeting. I have read a number of books by L. Ron Hubbard that I think are taken way out of context by people. Okay, now let me get to the point here. This is how I reduced the symptoms caused by the Seroquel. These symptoms did not exist prior to the Seroquel and reduced in severity and frequency after my stopping of the Seroquel, which was actually endorsed by an outpatient psychiatrist who was terrified of Seroquel because of the effects he saw in his patients and other people that saw me, police officers, my roommate, my girlfriend, everybody. My girlfriend at the time, everybody could corroborate this medication made me a delusional wreck, okay? And after stopping it, I got progressively better. Now, let's go further here. While working in mental health, many of my clients were drug users, okay? Many of the most popular drugs in my area are crack cocaine and heroin. One of my clients was put on Suboxone for heroin use. She stated to me that when she took the Seroquel, she was responding to it as a heroin addict, like she was getting the same high as heroin. And again, like I said, psychiatrists like to be responsible prescribers. So I don't think it was done purposely by her psychiatrist to harm her or anything like that. But what I would do is, I stated in previous videos, I would go to fda.gov and drugs.com, and I would get the lists of the side effects. Lo and behold, Seroquel is an abused street drug similar to Xanax, not for the same reason, but it's called baby heroin is the street name for Seroquel. Now, I'm not picking on Seroquel only. If you go down the list of psychiatric medications, what you will find is very little proven positive outcomes and very many negative side effects incurred by patients. Those that do have any positive supposed mental health results, you will see also that those mental health results are short-lived, which tells me it's placebo-oriented and not from the medication. And you will see they have very detrimental physical effects, such as obesity, hypercholesteremia, they have high blood glucose levels, and they, as a result of gaining so much weight and their activity level going down because of the drugs, you see massive weight gain, and with the massive weight gain comes, of course, increased risk of cancer, increased risk of diabetes, increased risk of disease in general. You also see smoking, which is not really recommended. Psychiatrists do not do enough to stop their patients from smoking, and you see this being exacerbated by the smoking. The health conditions caused by these psych meds are basically exacerbated by the client's regular behaviors. And another thing that you will see is the assumption that if a patient is prescribed psychiatric medication, they'll stop drinking alcohol. This is not true. A lot of problems that incur are when you're prescribing a person with a known alcohol addiction psychiatric medications. I did not have an alcohol addiction, thank goodness, but for some of my clients, some of them had to be hospitalized and other things due to the reactions caused by taking psychiatric medications with alcohol or within an hour, hour-to-hour range with the alcohol. My point is this. Psychiatry is not legitimate biologically based medicine. It is not. It is not neurology. In fact, if you were to ask a psychiatrist, and I know this because the one psychiatrist I called a good dude, and he is a good dude, flat out told me he would not even understand an electroencephalogram. Didn't understand it. Couldn't understand it. Now, my doctor that saved my life years ago, He ordered electroencephalograms because he was from the old school of the medical school of psychiatry. These newer psychiatrists that have gotten away from the medical school, well, think about that. They're prescribing medicines for problems in the brain, okay, that they know nothing about. They don't know anything about the brain. They know nothing besides what a regular doctor knows. And they cannot even interpret the tests used to measure the activity in different portions of the brain. But yet they pretend that they understand the brain, they pretend that they understand what causes these symptoms, and they pretend that they can treat these symptoms with pills, and if those pills don't work, they'll just add more pills to the cocktail.